All right, awesome. Okay, ladies, welcome back to another episode of the Bliss and Thrive podcast. Today, I am joined by Kate Howe, and Kate is an osteopath, and she's going to give us a really cool insight today into something we haven't really chatted about before on the podcast. So I think it's going to be really amazing information. So, Kate, welcome to the podcast. Why don't you introduce yourself a little bit to the gang?
Thank you so much. Okay, so my name's Kate. I also go by Katie as well. I'm an osteopath and I have been working in Mallorca since last summer. So I'm relatively new to the island, but I've been working in osteopathy for some years now. I treat all kinds of different people and different patients, but I've got a particular interest in women's health. Prenatal stuff, pregnancy and postpartum, and I also treat babies as well. So that's kind of a sum up of where I am.
What did you do before you got into osteopathy, or were you just right into that from uni, or like where do your interests lie and everything?
No, so I didn't kind of go straight in there. So I started off actually doing a Spanish degree, so it was something completely different. At school, I wasn't interested in sciences particularly. I was much more focused on languages and, that kind of more arty side of school subjects. But I did always have an interest in the body and health and well-being as well. So kind of skip forward, I did a Spanish degree, and then I was living in Chamonix in France and went to see an osteopath myself. And at that point, I'd moved with my husband as well. We'd taken a bit of a break from work, and we both kind of were looking for something else to add to our careers, and both going in kind of different directions. So took basically like a ski season out of work just to explore options a little bit. And it was there that I met an osteopath myself. And really everything came together, and I realised osteopathy for me, and I hadn't really heard about it before moving to France. Osteopathy for me brought together lots of my interests and also lots of my skills, I think, as well. So health and well-being and the body and how the body works, and really the opportunity to help people and offer a service. And really from your work, it's the most gratifying job because you really get to see what you can do to help someone. You see an end product. And of course you get to do it from beautiful places like the mountains in Chamonix or the island of Mallorca. Yeah. And I thought, this is brilliant. Why haven't I heard of this before? So then I retrained, and then I was working in London and then in Brighton on the south coast of the UK. And then an opportunity came up to work in Mallorca, and I thought, why not? Because then it combines my job and also I speak Spanish already.
Perfect. I think it's so, I really like that you took that little break to like find out what you wanted, and it can be so refreshing when you get out of your surroundings and like you feel inspired, and then it sounds like everything just kind of lined up for you.
It did. Yeah, I always think when I've had this conversation with a few people since, they say, oh, how brave of you to change careers. But actually I was very fortunate because I gave myself that space to really reflect back and go, what is it that I want to do and where do I want to go? But I always use the kind of analogy of, it was like I'd planted those seeds throughout my life. Like I'd done yoga and Pilates, and I was interested in health and well-being, and then the body. And then I needed that time to come away and then look back and see the garden grow and kind of give it that time and go, okay, it's osteopathy.
That's
Great.
meant to be. And how long do you have to study for?
So as an osteopath, you always study for 4 or 5 years, depending on the course. In the UK, it's 4 years full time. And yeah, it's pretty intense. It was a bit of a shock, to be honest, for me, because I came from doing a Spanish degree where I was a typical student and went to lectures for 10 hours a week or something. And then osteopathy is 27 hours of teaching plus clinical time, plus the fact you're older and your brain's not as kind of juicy.
Yeah.
Yeah, it's a pretty intense course. I think lots of people don't realise that with osteopathy, we actually have to know an awful lot about the body, not just the muscles and the bones, which is what a lot of people think of. They think of backs. But really, as an osteopath, we're dealing with anything that's connective tissue. So muscles, ligaments, bones, blood vessels, nerves, all of it really, we can change and we can affect with our hands-on treatment. But also we need to know a lot more because we need to know our limits and what we can't treat. So it's really, when you go to an osteopath and they ask you questions about things which you don't really feel is relevant to your shoulder pain, actually for us it's all relevant because we're making sure that it is a musculoskeletal problem that you've got and it's not something more serious. So are we the best person to treat you? Because often you can have pain in the body which actually is referred pain and it's not coming from that specific bit of you that's painful, it's coming somewhere else. So a classic example of that, which most people have heard of before, is if you have a heart attack, you might hear that people say that they get left arm pain.
Yeah.
Even they don't even get chest pain, they actually feel their left arm is funny.
So how does that work? What's the science behind that?
So it's a bit complicated, but
I shouldn't have asked.
No, you should definitely ask because it's a really interesting point to make. So the nerves in your body, they'll obviously go to muscles to give you motor supply. They'll go to skin. They'll also go to the organs as well. But really, they go to all their different places. But when they come back to send the signal to your spinal cord and then your brain, they kind of all bundle together as one and then go up to the brain. And the brain can't differentiate between whether it's coming from that organ or the muscle or the skin or the joint. And more often than not, it's our skin or it's our joint that's in pain because we've banged ourselves or cut ourselves or something like that. So it prioritizes that over organ. So it's the same with lower back pain as well. So it's quite common to get lower back pain and you think you've done something to your lower back, but actually there's something probably going on with your digestion, for example.
Oh, that's so interesting.
More gynecological stuff when it comes to women as well. That's pretty classic. You know, like most women have felt period pain and it's that feeling of like being in your back. Well, it's not actually in your back, it's in your uterus, which is at the front. But it's that same idea that things get
the signals get a bit mixed.
Yeah.
Amazing. And you said that your kind of specialized area is with like pre and postnatal and pregnancy and everything. So what would a typical like woman maybe who's pregnant, what would she come to you for, or what's your main thing you treat people for?
So with pregnancy, obviously your body's changing a huge amount and you're having to it's adapting pretty much every day to make space for the baby. So that puts a lot of load on the body generally, but particularly the pelvis and lower back. So pelvic pain is kind of probably the most common thing. So particularly what we call sacroiliac pain, which is really right at the bottom of your back by your sacrum, but probably normally to one side. And women would feel it when they're walking or maybe getting out the car, turning over in bed, those kind of times where that's probably the most common presentation. But also sort of rib pain and upper back pain, because obviously as well as your abdomen, not your stomach, but your bump is growing. Your breasts are also growing, so then that's putting a lot of strain through your upper back muscles. Your posture's changing, your center of gravity is changing, so those muscles at the back are really having to work hard to sort of pull you back up and keep you upright,
keep everything upright.
But everything with osteopathy and everything I see, it really is unique to the person, because our bodies are really like a map of where we've been in life, really, like what experiences we've had, how we've used our body, our profession, how much sleep we get, how do we cope with stress, have we been through trauma, and that can be physical or emotional. I mean, it's really varied, and that's one of the things I really love about osteopathy actually is that it's tailored specifically to each individual person. So although I might see the same presentation in pregnancy, for example, with like sacroiliac joint pain, the reason behind it, other than the pregnancy, will be quite different person to person. So it might be that I can think of somebody I saw the other day who'd had a very bad ankle sprain, and that had kind of altered how the tensions went up her body, and so that's why she got on that side. Yeah, it really varies depending on the person.
I think what I like about everything you're saying, and like what I can understand, is like how connected everything is. You see the body as a whole, and like it's not just like, oh well, you have pain here, so we're just going to treat this. You look at the whole picture.
Absolutely. So that's one of the things that we always say about osteopathy, is it's holistic, as in we really do take into the whole body. So I think sometimes people can be a bit confused, thinking, I came in with neck pain, why is she looking at my knee? But it's literally connected through the body, but it also all works together as well. One of the kind of principles of osteopathy that we say is the body is a unit. It works as one thing. It's a team, and when one of the team is being a bit lazy or not doing the job, the other guys have to really
pick up the slack, kind of thing. Yeah. And that's when you get imbalances.
Precisely. So that's from a physical perspective, but also it is all connected on a kind of emotional and mental level as well. So I think pretty much every patient I see, apart from something that's very obviously traumatic, like if it's a broken bone or you've taken a tumble on while skiing, then there's loads of things that people will have and they'll say, I don't really know what I did. I was just putting my socks on.
Yeah.
Or I was just like doing something that I do 1,000 times a week. Something really innocuous and not very significant. But actually, I always encourage people to just try to really think about what else is going on apart from the physical, and what else is going on in their life. Because as well as, although I deal with the physical body in terms of, that's why people come to see me, because they're in pain physically, it's also connected, and often the body's really clever. It will adapt and help you out, but up to a certain point, then it can't really do much more, and it needs a bit of help. And with pain, and you think, oh, it's just come from nowhere, there's nothing going on. Often you find that there is kind of a lot of stress, or people haven't been sleeping, or they've got some kind of anxiety, there's something they're worrying about, or they're making a big change in their life. All these kind of things can really lead to that little niggle that they might never have really noticed has now kind of really reared its ugly head.
Surface, yeah.
Significant. And that's because the body is trying to tell you something, perhaps on a more emotional level, but you're not really paying attention to it, and you're soldiering on.
Yeah.
And then it kind of goes to the next level and thinks, right, how am I going to get this person to really listen to me? Okay, I'll turn up the pain signals, because then we all have to stop and pay attention to it.
It just goes to show that looking after yourself in all aspects, keeping your stress levels down, and being intuitive and mindful about your body, and, keeping a check on, do I feel good? Like, how do I feel? How do you feel? Yeah. Like taking a stop and just asking yourself how you feel. And how would you go about treating that? So if someone came in and you think it's probably emotional, like what's the process for that?
again, it depends on the patient, because it's all so different. But I would always start off, obviously, kind of my main mode of treatment is hands-on.
Yeah.
And it's assessing, and I want to make a change physically as well. So where there's tight muscles, I'll start by massaging them and doing soft tissue work. But then it's just having a conversation with people, really. And really, I don't like to kind of push people beyond what they want to tell me. And often I won't even ask for details. I'll just say, do you know, sometimes this shoulder pain can be a sign that something else is going on. You don't have to tell me, but just check in with yourself. And I think sometimes that's all it needs, because really we probably do know that subconsciously we're doing a bit too much, we're putting too much pressure on ourselves, or we know we're not sleeping enough, we know we're not right. And actually just somebody else kind of pointing it out is maybe enough to check yourself.
Takes a professional to be like, have you looked after yourself recently?
Precisely.
And it takes an actual professional, not just your husband or whatever.
Sure. And it kind of then gives you permission to say, okay, somebody is telling me I need to look after myself. Now I really need to do it, because look what's happening. But so conversation, really, with a mixture of hands-on treatment, I'd say. But I liked what you said then about kind of connecting to the body, because it really is. Yeah, I'd say that's simple. I mean, but we all are guilty of kind of disconnecting.
I think we keep our minds so busy all the time, and we are busy. Like, you know, maybe you have kids, you have a busy job, we're running around here, there and everywhere. And then when you get that downtime, you whip your phone out and you're checking Facebook and Instagram, and you never take that moment to check in with yourself and just check if you're all right. And if you're not someone who's body aware, so I used to be a dancer, so I feel whenever something's not quite right with my body, the tiniest thing, I'm like, oh, that's different. I know straight away. I know my energy levels. I know every little ache, pain, tweak. I know everything. I've just become so body aware, because my body is my tool, and now as a personal trainer as well. But forget, I guess, the everyday person, you don't become aware and you don't become mindful about what's going on with your body.
Yeah, precisely. And it's wonderful to be body aware, and it's one of the most powerful kind of tools for taking control of your own health, because then you know. I think that's also why I like what I do, and also I like alternative therapies generally, because people really listen to that. To me as an osteopath, it really makes sense. If someone says it's not feeling right, I get it.
It could be simple as that.
But with kind of mainstream medicine, unfortunately, GPs don't have the time and they don't have the luxury to sort of explore. Their job is much more emergency medicine and ruling things out of kind of more life-threatening causes. And so, it's nice when it's a lot of body awareness in terms of, that's why I think alternative therapies go really well for people that do kind of connect to their body quite well, because
makes sense.
It makes sense.
I remember once I had a problem with my rotator cuff in my shoulder, and this is when I was working on the cruise ship, so I went to the doctor on board the ship. She gave me oxycodone, diazepam and codeine, and I basically had a panic attack and threw up everywhere. I can't take any kind of drugs, and that was to treat my shoulder. So I wish we'd had someone like you I could have gone to, just actually find the root of the cause, because I don't even know how I did it. It just came over time. Stress. But I was like, wow, this is a good cocktail I've got here.
And it's kind of a classic scenario, really. I hear that a lot. So people, and I'm not against medicines at all. I'm not kind of anti.
Me neither.
They are brilliant things. They are life-saving, wondrous inventions.
But taking a painkiller and not finding the root of the problem.
Yeah.
Yeah.
Precisely. So it's really finding the cause, and that's why it's brilliant. It's great that we kind of look at the whole body, because it makes sense to me. You're not just looking at your shoulder, you're looking at how do you move, what else is going on, and you kind of plot it through your body. You can sort of see your movements, and maybe your rotated cuff problem was a secondary issue because you didn't have enough movement going on in your upper back, or your breathing had altered because you were going through a stressful period or something like that. It could be a whole host of reasons, but
that's so interesting.
That I think is really where we make quite a lot of change.
Yeah.
Yeah.
Oh, I think it's so interesting, like, because just how it's all connected. I just love it. I love anatomy and everything anyway. But like knowing everything on that deeper level, I'm just so jealous of your knowledge.
Yeah.
Like, I'll just nip off to university for 5 years.
Yeah, that's it. I do say to people, like, it's the best, like, you should really do it. And then they kind of say about how long it takes. And I'm like, yeah, I know it's difficult, but it's completely worth it. But I mean, it's wonderful that you have such a solid foundation for really exploring all this stuff, because anatomy, being body aware, having your dancer background and your PT stuff, it all comes together beautifully for you.
Yeah, and I try to impart that on my clients as well, like just feel what we're doing, feel your body, feel when you feel good and what doesn't feel good, you know, try and connect. It's the best way, really.
Yeah. And I think it's good because people like yourself and me, we can kind of tell people how to move or how to do an exercise or whatever. But actually, I think it's also nice when we can just give people the confidence to do what feels right for them.
That's the number one thing.
Yeah. I mean, I always say, like, you know your body the best out of anyone in the world.
Yeah, you can't feel my body.
Like, I just cannot. I cannot. I'm all right, but I'm not that good. No, but, you know, trust yourself as well. And that's part of really getting to that kind of body connection and really listening to yourself and listening and developing body awareness.
Yeah.
Which is something that I think is really useful for everyone, and just checking.
I think so too. Massively. Oh, it's been amazing chatting to you, Kate. Such a wealth of knowledge. If anyone wants to get in touch with you, if they have any questions about osteopathy, how can they get in touch with you?
So probably the best way is through Instagram. That's what I use, and it's island.osteo.
I don't even follow you on Instagram.
What?
I will now. You'll have one extra follower. And if anyone's listening to this now and you want to take a little screenshot, if you like what you're listening to, you can tag Kate at island.osteo and me at blissandthrive _ and pop us in your stories, and then we'll say hello, give you a little shout out. And if anyone is in Mallorca, in Palma, and they need to see an osteopath, head to Osteo Palma, ask for Kate. Sounds pretty good to me. And then thanks so much for listening, everyone.
Thank you.